made you become a doctor, Dr. Ballantyne?
Well, actually, my dad was a physician, and growing up in the household of a physician, it just seemed to be the course that it was always assumed I would follow. He was my model, and I just followed in his footsteps. He was in solo practice, and that seemed like a very nice way to plan my life. I felt I would be my own boss, and it was something I could do for as long as I wanted to work.
Where did you go to medical school?
Well, I went to medical school at the University of Rochester in Rochester, New York. I had gone to college at Harvard and decided that I wanted to go to medical school away from the Boston area. And I went out there one November day, and Arthur Pappas, who now is or has been the chairman of the Department of Orthopedics at the medical school, had been a year ahead of me in college, and he showed me around the school and made it sound like a lovely place to go for the next 4 years. I found it to be a school where there was not an emphasis on grades, and it was a grand experience. Actually, after medical school, I then pursued my internship at the University of North Carolina in Chapel Hill, North Carolina. I was there from 1958 to 1961 doing a year of internship and 2 years of residency in internal medicine. I think that was perhaps one of my favorite periods in my life. We had a wonderful group of house officers there. The faculty were just wonderful physicians to learn from, and it was a grand learning experience. We worked 36 on and 12 off. Or really 33, 34, and 14 or 15 off. And enjoyed every minute of it.
What year did you graduate again?
I graduated from medical school in 1958.
Okay. So what made you choose your specialty in medicine?
Again, I think it was because of my dad. He did internal medicine. He specialized in diabetes, and I always admired him. When I was a youngster, I used to ride with him on house calls. He then, I recall, most every Sunday I would ride to the city hospital and sit in the parking lot while he attended his patients. When I became about age 13, I took on the responsibility of keeping his office clean uptown. Was dropped off there and cleaned the office, and sat there for 2 hours and envisioned myself being there at a later date in practice, which did come to fruition. After I was at Chapel Hill, I joined the United States Public Health Service. At that time, physicians generally went into the military or did some sort of service time, and I chose the Public Health Service and joined the so-called heart disease control program. We were assigned to, or I was assigned to Albany, New York, to the health department of New York, and during that 2-year period, I became quite involved in a program where we provided educational programs in cardiopulmonary resuscitation. A closed chest cardiac massage had just been described in 1960, And so it was a hot new item, and we set up a series of programs in Upper New York through all the hospitals for physicians to learn this new technique. We had a few of the resusciantes, which were the mannequin we used to teach the technique, and we sent these out with the physicians who gave the programs. And it was for me, it was a very interesting way to spend my service time. After I left Albany in 1963, I went to Atlanta, Georgia, and served my last year of residency at the Grady Memorial Hospital, which is affiliated with Emory, as a resident in medicine. The reason I did this rather than take a fellowship was I had not done clinical medicine for the 2 years in the service, and I felt I wanted to get my hands back in the action. Again, that was very much a fun experience with many happy memories. Then the decision came to go into practice, and I came back to Worcester.
Okay. Well, before we get to your practice, could you tell me how much it costs for you to go to medical school?
Well, I made some notes on that. I actually can tell you that off the top of my head, but I'll pull up my notes. When I went to medical school, the tuition was $800. And it rose to $1,000 after a couple of years. At that time, I lived in a rooming house, or in a private residence, had a room, which cost $6 a week. We ate most of our meals in the hospital, but when we went out to dinner, a spaghetti dinner was 65 cents, and if we had meatballs, it was 75 cents. As far as the cost of medical school goes, this was similar to what it was at college. When I went to Harvard in 1950, it cost $600, and either 1 or 2 years later, I recall the tuition is going up to $800, which also included the cost of the tickets to the athletic contest, which were not included in the $600 tuition. And in addition to that, room and board at that time in college was $600 to $800. So there's been a big change.
Right. So do you feel like you were affected at all in your decisions after graduation, like where or how you practice medicine at first, due to the cost of medical school?
I really wasn't. My dad paid my tuitions, and I really was not aware of any financial burden, or did not have any financial burden growing out of my education.
And how do you think the increased costs of medical school today affect young doctors after they graduate with their choices of practicing?
Well, unfortunately, I think it probably does make a difference.
Right.
I think in some instances it probably hurries them into practice, and I think it makes them less likely to serve in practices where they would perhaps doing more volunteer type activities with their medical learnings.
Well, let's get back to your practice now. So could you describe the typical day when you first started practicing here in Worcester?
When I came home to practice, of course I had not done any medicine in Worcester. I had not been a house officer here, which was the case of most of the docs going into practice at that time. My dad helped me, as did many of his colleagues. When I first started practicing, I had a part-time job at Norton Company, and I then had office responsibilities. I went to the office, and then I had hospital patients, made house calls, nursing home visits. I did any number of different things as I pieced together my day. Things at that time were rather slow going when one first started practicing, because much of what you did came from other doctors who either asked you to see patients because they were going away or various reasons, and it was slow going.
So how did your day change as you practiced over the years?
Well, as time went along, the office practice would increase, and one would generally do more in the office, more in the hospital, and you would do less work at schools or less work in nursing homes, perhaps, other activities of that sort.
Did you use the telephone often to talk with your patients?
Yes, we answered our telephone 24 hours a day. The phone that rang in the office also rang at home, and we were always available by phone to our patients. My mother, who was an integral part of our office practice, answered the phone at home, and so we were always available by phone. There were answering services at that time, just starting, so that came into play.
Okay. What year was that?
1964 is when I started practicing.
Okay. Would you care to describe more about your rounds in the hospital and what they were like?
The rounds in the hospital varied whether or not one was on service and taking care of service patients or taking care of your own private patients. When we were on service, we met with the house offices, made rounds on all the service patients, usually spending an hour or two discussing the cases. We did that usually 2 months a year. When they were merely rounding on my private patients, I did that alone, and then generally talked to the house officers at some point concerning the patients, but did not make the rounds with the house officers generally.
How many patients would you have generally at any one time in the hospital?
Generally, there would be 6 to 8 patients in the hospital. When we were on service, obviously, there were a lot more patients. In the summertime, it often would get up to a higher number because I would be covering other practices, and then it would be very busy.
So who were your patients? Like, where did they come from? Or, I mean, generally, who were they?
Well, generally, my patients were middle-aged and older. I think my practice tended to sway toward a more elderly practice. I'm sure this was because many of my patients came to me from my dad as time evolved, and then from other doctors who were cutting back, and I would see their patients.
So what do you think it was like for your family to have a physician in the household? Did you work long hours? Do you think that affected your family life at all?
Well, I was single during much of this time. So my family life included my father and my mother. Obviously, my dad was a physician, so this was nothing new. My mother always had dinner waiting when I came home, which often was 7:30, 8 o'clock. Not because of work necessarily, because usually I had a tennis match or a squash game scheduled in there also. But so it worked out very nicely for me.
Did you take vacations?
I generally did not take vacations. I really didn't have any great interest in traveling. I had a surplus of extracurricular activities in Worcester in this area that I could pursue, and I never felt any great need to get away for periods of time. I also preferred to keep my hands on my practice. I felt the continuity of care was much better when I was home, and I kind of like to take care of I enjoyed taking care of my patients on a day-to-day basis, and really felt no great need to get away.
But you still had plenty of time to see your parents and to play sports and enjoy
Yes, I certainly did.
So once you started practicing, what made you keep being a doctor for so long? I mean, what did you really like about your particular practice?
Well, I don't know that I ever thought about doing anything differently. And frankly, I don't know, once one is into a practice mode, there are that many opportunities wouldn't be that many opportunities to switch out of it. But I guess I liked the day-to-day contact with my patients, who really became my friends, and I never really entertained doing anything differently.
Do you think doctor-patient relationships have really changed since the time you started practicing back then? I mean, do you think doctors can still be friendly with their patients and become friends like you did?
I think they can, although I think medicine is different with group practices and such as that. I think medicine has become more 9 to 5, and I don't think you really get to know the patients in many instances as well as we did, the way as solo practitioners we maintained our practice. I know there are a lot of exceptions to this, but generally I don't think there's the familiarity between patients and physicians like there was years ago.
So what were the most typical illnesses that you dealt with early in your career?
By the 1950s, when I got involved into medicine, antibiotics had come into play, and so pneumonia, infections of that sort, tonsillitis, strep throats, were under a fair control. When I first became aware of the practice of medicine, basically in my dad's practice, I recall the cases of pneumonia that he would have and how he would worry about them. And then I remember in the late 30s, sulfa came along, and that seemed to help. And then in the 40s, penicillin, which proved to be the great savior in so many instances. So pneumonia to me was so common in the 40s, and then helped by the 50s. When I think of the 50s, during the period I was in training, I think more of heart disease, congestive heart failure, hypertension, which seemed so common. During that period, diuretics were developed, which seemed to help in with many of the problems. Surgery came along for rheumatic heart disease. There were many really miracles with surgery for rheumatic heart disease. So those would be the things I would think of in the 50s. Common illnesses after that, there really are so many, it's hard to single things out. I had a lot of patients with diabetes because of the fact that my dad cared for them, and then they fell to me, so I saw a great deal of that. And mentioning diseases in the 50s, I also think of tuberculosis. When I was in Chapel Hill, we had a large sanatorium there where we spent time, and new medications appeared during the 50s for treatment of tuberculosis, which were very satisfying in the care. And tuberculosis really became seemingly not an important disease in the 70s and 80s, although it now has become more of a problem with resistant forms and such in more recent years.
So could you single out any one disease that's the most challenging for you to treat?
When I first started practicing,
Right.
I felt it was probably congestive heart failure, heart disease in general. We did have mercurials initially as diuretics. I remember making many house calls with my bottle of mercurhydrin or thiomerin and treating patients, and the lack of good therapy was frustrating indeed at that time. Then Lasix came along and many other drugs which were very efficacious.
How about later in your career in medicine? What was the most challenging to treat in your field? I'm sure it changed, right?
Well, there are so many different diseases. It's hard for me to single out any particular ones, really. I think you, at one point, wondered what were the most challenging, what was really challenging when, at the time I stopped practicing. And in thinking about this, one thing that came to mind were lifestyle conditions.
Okay.
Smoking, obesity, alcoholism. I found these to be a real challenge and dealing with patients, and very frustrating to deal with, in addition to the other true diseases which we confront in medicine.
So what would you classify as one of the most important breakthroughs in disease treatment during your career? You said that antibiotics were already there when you started practicing, right?
Yes.
So,
Diuretics, I would think, would be in the class of medication that represented a wonderful advancement for us.
How about disease prevention?
I felt polio vaccine was a very meaningful advancement. And I know you once wondered what was the worst epidemic I recall.
Right.
And to me it was polio. And I think that's because in my age group we were very conscious of polio. As I think back to my youth, I can think of at least 3 acquaintances who were left severely impaired by polio in the early 50s, which was and polio was a real fear of families at that time.
So what is something that doctors seem to take for granted now in terms of technology that you didn't have at some point in your practice?
In that area of new technology, I would think of the scanning techniques, CT scans, MRIs, ultrasounds. They just weren't there when we started, and it's amazing what they've done in the management of medicine.
What technology is still being used today that you used frequently in your practice early on in medical school?
Well, when I started practicing, the technology that I recall, and I'm sure I'm leaving things out, we had EKGs, EEGs, obviously diagnostic x-rays, blood tests, and I'm sure other things that I've forgotten, but those are the things that jump into my mind.
Do you remember any other technology or procedures that you used early in your career that maybe aren't still used today?
I can't, off the top of my head, I can't.
Sure. What would you describe as one of the most important inventions that you've seen throughout the course of your practice, like the single most important?
Well, I would think MRIs, that type of scanning technology would be what I would think of.
Did you have access to the new technology in your field?
Well, I did through referral.
Is there anything that you'd like to see invented in the medical field?
I'm sure there are 101 things that should be invented. I can't really come up with anything I'm specifically thinking of.
Okay. What were some of the most important drugs that you used in your practice early on and throughout the course of your career?
Well, when I first started practicing, again, I would think of our use of the mercurials, mercurhydrin, thiomarin. We used insulin, Diaril, acromycin, would be things that come to mind. Are they still used today? Well, the mercurials are no longer in play. Diuretics have become much more sophisticated, as have antibiotics, gone through several generations of development. Obviously, insulin is still there, but that too is in a new generation.
And have you always had access to these drugs that you wanted to use?
I would feel we always did have access to the drugs we wanted to use.
Okay. Would you like to describe any particular breakthroughs in drugs that you've seen in your practice?
Well, I think among the ones that interested me were the oral hypoglycemics, which have certainly gone through a considerable evolution. Tagamet, cimetidine, that grouping of drugs. I'm sure there's a number that I'm not coming up with.
Could you briefly describe attitudes towards smoking and cancer throughout the course of your practice? I mean, the general attitude and how your attitude changed as well.
I think when I first started practicing, smoking certainly was accepted, practiced by many physicians. Personally, I always was opposed to smoking, never having smoked. And clearly today it's out of favor. I always included questions about smoking and alcohol use in my history and physical exams, and always encourage people to reduce their smoking or not smoke. As far as cancer is concerned, I think that's always been a dread, feared disease, and I don't really think the attitude toward it has changed that much.
Early in your career, how did patients without money receive health care?
When I first started practicing, I did most of my work at the city hospital, and we had a very large outpatient department, and that's where a lot of people went who did not have money. Also, a lot of pro bono treatment was done.
Do you think that everyone who needed health care received it back then?
I think if people searched it out, the care was available.
Over the years, how do you think Worcester is compared to other places in terms of providing care for the underserved, if you can make a comparison?
Well, I would feel Worcester would do a very good job in that area. They had the facilities at the municipal hospital. In later years, other groups have formed who take care of the indigent population, so I think they've been well served.
What were some fears and concerns about socialized medicine in the 50s and 60s?
Well, I think the concern always was that the government bureaucracy would be overwhelming and there would be a resultant decreased quality of care.
Did you see physicians get involved politically on the topic of socialized medicine?
I'm sure the physicians did get involved in the concerns about socialized medicine. That in the 50s and 60s, I was really pretty green, and I don't really think I was aware of what was going on in the politics of medicine at that time.
What were your feelings on Medicare and Medicaid when they came around in the 60s?
Well, I actually started practicing 6 months before Medicare started. And when it started in 1965, I really thought it seemed like a very good thing. And I felt very positively about it. It certainly provided a good insurance for the senior citizens. As far as Medicaid, I'm not really sure just when Medicaid started. There always was public welfare, which provided care through the cities and towns. And I believe that when Medicaid took over, that merely was a matter of the state assuming the responsibilities that the cities and towns had in providing public welfare to the indigent. And I feel it just continued on as much as it always had.
So how do you feel that the government's overall involvement in healthcare over the years has affected physicians particularly?
I feel that the insurances have provided good care for the consumer. I do feel that sometimes they have gotten involved in too many different services or trying to provide too many different services and dealing with too many different providers, and which has led to some abuses really in the Medicare and Medicaid area, as well as in other insurance areas.
How do you feel that the public's access to care has generally been affected by the government and healthcare?
I think the access to care has certainly probably been enhanced by having Medicare and Medicaid, although in some instances physicians refuse to see patients with those insurances, which I guess creates problems.
When did HMOs first impact your practice?
HMOs probably first impacted our practice in the 1980s when they first seemed to start their rise. The impact, I guess, I noticed was there was a shifting of patients depending on the insurance which their employer carried, so that all of a sudden patients stopped coming to you, and then when you bumped into them, you realized they couldn't come to you anymore because they had a new HMO which you were not involved in.
What are some positives and negatives about HMOs, in your opinion?
Well, I was very involved in the development of Central Mass Healthcare and was on the original board of directors and served as the treasurer for many years. I felt that from a positive standpoint, it certainly gave limited financial exposure for the patients and really provided good care. From a negative standpoint, it seemed to me there was a greater flux and much change in the caregivers in the HMOs, and there just didn't seem to be as much stability in the care and the providers. I'm not really that knowledgeable now what's going on in these areas, but I gather that in many instances it's felt by the physicians that the reimbursements really are not adequate.
Moving on now, could you tell me how doctors' salaries have changed over the course of your practice?
Well, during the course of my practice, there was a steady increase in the income. When I first went into practice, office visits were $5 and house calls were $7. And I think there was a steady increase in charges and reimbursements during the course of my practice.
Where did the bulk of your income come from in the early part of your career?
When I became aware that this question was on your list, I decided to pull out my records from the first year I went into practice, because I was interested to see just how things worked out the first year I was in practice. So I'll be very specific.
Sure.
In 1965, my business gross was about $19,000. From that income, about $7,000 came from Norton Company, where I had a part-time job working in their hospital, examining patients who had minor injuries, illnesses, doing pre-employment exams, periodic exams, various services. I noted that my income from the hospitals at that time was over $4,000, which rather surprised me, but I guess was related to the fact that I did a lot of covering at that time and admitted patients to the hospital for other physicians and was covering for physicians when they went away, and saw a fair number of hospital patients. In the house call column, I noticed that my income was $3,700. I assume this included nursing home visits, although I did not mark it that way, but I assume it was house calls and nursing home visits. In the office, I earned $1,600, and I had another part-time job where I did exams in the elementary schools, and I see that I made $1,400 that first year from that position. To fill out the income, I also made $500 from examining some students at Becker Junior College, and I did some insurance exams, which accounted for about $250. So that's kind of the makeup of a first year in practice. I also thought it might be interesting to record the expenses for 1965, which totaled $2,000. Now, this is not a fair expense number in a way, because I paid no rent, as my dad took care of the rent for our office. I should also say that my mother answered the phone and handled those sorts of responsibilities, so we had no help in the office. Our expenses came from automobile expenses, which totaled $1,000. Phone expenses were $290. The answering service was $189. Dues for the Worcester District Medical Society and the Mass Medical Society were each $35. A narcotic license cost $1 at that time. The Mass Medical license charge was $75. And the malpractice charge in 1964 was $76, and malpractice insurance in 1965 was $82. I also happened to notice that in 1972, the malpractice premium was $165. That was for coverage of 200,000, 600,000, which was the usual coverage that one had at that time. Oh, I also thought it was interesting that car insurance in 1965 for a physician was $258.
Okay. Well, thanks for the specific breakdown there.
I realize that's very detailed,
Yeah.
and not what you probably expected.
No, that's good though. So how has malpractice insurance changed over the years, as well as its impact on doctors' practices?
Well, we all know that malpractice insurance has become frighteningly high. I really don't know how much it is for a physician today, but if in 1964 it was $76, it is at least 100-fold higher for a medical man, for one practicing internal medicine, although I really don't know the specific amount. As far as the impact on physicians, I realize that today they give up certain parts of their practice because of the huge premiums, and I'm sure it makes everybody practice defensive medicine. It is a real burden in medical care today.
So how did you learn the business of medicine?
My dad, again, was a physician, and I observed the way he kept his books and the way he ran an office, and I managed to run mine the same way until I ended my days in practice.
And you helped your dad with his office early when you were younger, right?
My dad passed away in 1977. He practiced until a month before he died, and I was able to help him out during those last years of practice, covering him in the hospital and allowing him to do what he really enjoyed to the end. And then I just took over the responsibility of the whole office.
What are are some changes that you've seen in the demographics of Worcester?
In the 70 years that I've lived in Worcester, clearly there has been a change in the demographics with increasing numbers of minorities coming to enjoy Worcester. In reality, this did not really impact my practice very much, I would say. I had a rather fixed practice which was passed down to me, and I stopped taking new patients 6, 7, 8 years before I stopped practicing. So there wasn't really too big a change in the demographics of my own practice.
How did you see women's health in Worcester change over the course of your practice?
As time changed, we got more and more women practicing medicine in Worcester. And I think I noticed that, especially among the younger lady patients, many wanted to have women for their physicians. Also, in my own practice, I referred many of my women patients to gynecologists for that aspect of their management.
And how have you seen the experience for the female physician change?
I'm really not too aware of that. To me, the female physicians are 100% part of the practice of medicine in Worcester, and when I first started practicing, there were very few, but they were well accepted and well loved by their patients. And the main change is the fact that there are just more and more women practicing medicine today.
Are there changes in children's healthcare that you would care to comment on?
The children's health care is something I really have no knowledge of.
How do you feel the role of the physician in the Worcester community has changed over the years?
I think when I was younger, I think the public perception of a physician was of respect, and I think today there probably is less respect for the physicians. As far as their role in the community, to me it's much the same as it has always been.
Are there Worcester physicians that you admired when you were practicing?
There very definitely were physicians I admired when I started practicing, and I think as time evolved, there were always certain physicians one respected and really looked up to and felt they were model physicians.
Would you care to describe any one of them or talk about it?
I really hate to single out any particular physicians because I don't want to leave anybody out.
Okay, that's fine. So what do you like best about practicing here in Worcester?
Worcester was my hometown, and I think Worcester's a wonderful place, and I found it a very satisfying place to practice. It's just like a big, small town. I liked the ease of getting around Worcester. I always felt that if I had to go see somebody at home, was no hardship to go to their home. I could move around Worcester very easily, and I found it a good place to practice.
Is there anything you don't like about practicing here, or you didn't like?
Not really.
Okay.
No, I found it a very satisfying place to practice.
How have you found Worcester how have you found it different from other places that you practiced? Were there any other places that you ever been?
This is really the only place I practiced. My medicine in the other places was always during my training.
So do you have a favorite memory or memories from your entire career or your time in medical school that you would like to share?
Well, my favorite period really was when I was at Chapel Hill for 3 years. I think I was learning medicine. I had a grand group of people that I worked with. We not only worked hard, but we played hard, and it just had a lot of fun. You mentioned memories. I think one has a lot of memories of patients they've seen and happy results and things of that sort. When you asked the question, do we make house calls, I thought of one rather amusing memory. I remember when early in my practice we got a call to make a house call down on the island, and so-called island down Lafayette Street and Lambertine Street area. And I got in my car and drove down to the three-decker where the call had come from. Started up the steps of the three-decker, and Dr. Arthur Ward came walking down the stairs. And I said, Arthur, what are you doing here? And he said, well, I was called to see Mrs. Jones. I said, oh, I just got a call to see Mrs. Jones. And Arthur said, well, we're all set. So we laughed and walked down the stairs. We went out the gate from the three-decker, and we're standing beside our cars, and up drove Dr. Robert Kelly. And we said, Bob, what are you doing here? I've come to see Mrs. Jones. And we laughed and said, well, we all made it, and had a good laugh and had reminisced about it subsequently. But I think when people in those days questioned were house calls made, obviously there was an instance where when the family called, they were apparently given 3 names of people that might come. They called all 3, and we all came. But I always remember that as one of my funnier moments in practice.
Do you have a least favorite memory from your career in medicine?
I suppose as I think back on the career, the increasing amounts of paperwork were the thing that became overburdening and really are not a pleasant memory of practice. It just, toward the end, became an awful large part of the day and was not much fun. And a lot of that was because of the way we ran our practice and tried to take care of it in-house, so to speak. Another least favorite memory would be the closure of the Worcester City Hospital. My family had been wedded to the practice of medicine there from the late 20s, and I hated to see it close. We knew it was necessary and that there was no way out, but it was rather sad to see an institution which I felt had served Worcester so well through the years had come to an end.
Well, as medicine has always been a changing and growing field over the years, how have you found yourself keeping up with the changes in medicine in terms of education after medical school?
Well, after medical school, we attended rounds on a weekly basis, which I think is where most of our day-to-day education came. There were journals which we read that kept us up to date, and dealing with our peers certainly was a big part of staying on top of things as far as the new advances in medicine were concerned.
And that remained the same throughout your career?
This continued up till the end. And even after the end, I continued to go to conferences because they were fun for us.
Would you care to name any of the journals that you read, if you can remember?
Well, the New England Journal, of course, was a prime one. The AMA.
Okay. So, lastly, what advice do you have for younger doctors just starting out in their practice?
Well, I think the main thing is you shouldn't get discouraged. Medicine really is a wonderful profession which can be very self-satisfying. It's really a lifelong educational journey with many intangible rewards as you associate with your colleagues and your patients. Unfortunately, there's a lot of current turmoil, but I think with time, this will iron out and the practice climate will really become a more enjoyable one for all.
Well, do you feel that we have anything left to talk about or anything else you want to say?
I think that pretty much covers it. Umar, thank you.
Well, that brings us to the end of our interview, Dr. Ballantyne. Thank you very much.
Well, thank you. It's been educational to do it.